having a little back pain. Okay. Well, if you can have a seat right there for me. All right. Yeah. All right. Well, if you could rate that pain for me, and that you're having in your lower back, on a scale of 0 to 10, 0 being no pain at all, and 10 being the worst pain you could ever imagine, what would you rate that?
I'd probably say a 6.
Okay. All right. Well, what we're going to be doing today is we're going to be doing a few different things. And first of all, if I could just have you lay down on your back for me. All right. And the first thing I'm going to be doing today is just checking to see if you have a separation between your abs, which could be contributing to your back pain. All right. So what I'm going to have you do, I'm really sorry, is bring your knees up. And what I need you to do is just leaving your hands just like this. I'm going to ask you to lift your head up. All right. And do you mind if I roll your shirt up?
That's okay.
What I'm going to ask you to do is just lifting your head just right off that pillow right there. Relax for a second. Right. Go ahead and lift your head up. Okay. And relax for a second. Good. All right. Go ahead and lift your head up again. All right. Good. All right. And if I felt the separation greater than 2 finger widths, it would be considered diastasis recti.
So then, since our patient has it, we're going to do a corrective exercise. So what I'm going to have you do is I'm going to have you bend your legs up. Okay? And I'm going to have you securely wrap your hands around your stomach. What I want you to do is I want you to lift your head up off this pillow. And as you do that, I want you to exhale. And as you do that, also try to pull the sides of your stomach in towards the midline of your trunk, okay? So you lift your head and exhale, and slowly bring it back down. And we probably do that
2 sets, 8 to 10. Or
How
she
many
can
what?
stand it. 2 sets, 8 to 10.
2 sets
8 to 10.
of 10.
10.
The affirmative. Either 10 or 8.
Well, it didn't really say in the book, so.
Okay.
How are you feeling? You okay? Are you having any pain? Okay, and then we'll do another one.
This one is going to demonstrate the patient can't actually wrap their arms around themselves like she was doing. I would have her kind of lift up like I'm placing a bedpan underneath you. Put this underneath. Excuse me. Okay. Alright. So just like you were doing before, you're lifting your head up, okay, and exhaling at the same time. This time what I want you to do is as you're lifting your head up and exhaling, I want you to just kind of take your hands, put your hand on each of these, okay, and kind of squeeze, apply some pressure so it causes resistance. Okay, so lift your head up. And as you're doing this, I want you to do something called a posterior pelvic tilt, which means going like this, just kind of moving your pelvis backwards like that, okay? So do that at the same time as you're lifting your head up and exhaling and pulling that at the same time. That's also going to help you with your strengthening those muscles. You're not able to kind of like wrap your arms around yourself like that. Make sure you're not holding your breath. Breathe when you have your head down and exhale when you come up. Do that posterior pelvic tilt and apply the pressure, okay? We're going to do this 8 times. Have you do 8 of those, 2 sets. And that will conclude our treatment for today.
Progressive exercises now?
Well, that's just a
Correct.
correct.
Okay, Jen, I heard you've been doing well with your ab work, so we're going to kick it up a notch today. So if you want to follow me, we're going to do some other exercises.
My shoes.
All right? Yes. Yeah, you do need some stable shoes. So we're going to do a little bit of lower body and upper body work. Plus, you're going to get some cardio today. So what I want you to do, put this behind you, so there'll be a wall squat, okay? And I want your feet out, nice, comfortable, about shoulder width apart. You don't need to go down too far. Don't get over your knees. Just go down and up, okay? Down and up, okay? So go ahead and try that. We're going to do 3 sets, 10 times, okay? 1. And I want you to breathe out when you come up, okay? 2, breathe in as you go down. Okay, breathe out. Okay, all right, that was 10. All right, and now we're gonna do some upper body. What I want you to do is a wall push-up, okay? So I just want you here. This is gonna strengthen your back, arms, pretty much everywhere, okay? Just like a regular push-up. Go all the way down and up, okay? And we're gonna do 3 sets of those. 10 times. Good. Alright. Okay, good. Alright, that was 10 times. Okay, now we're going to go to the treadmill and you're going to go 20 minutes bike walking, okay? Alright, good job.
Alright, who's next?
Go.
Is that it?
You're next.
Hey, patient, have a seat. Exercises worked out well? I just wanted to provide a bit of instruction concerning proper body mechanics and lifting now that you have a new baby in the house. And there are a couple things that you're probably already doing. Do you have a crib for the baby?
Yes, I did.
All right. Does the side go down?
Yes.
All right, excellent. So whenever you're going to lift up the baby, I want you to make sure that you bring the side of the crib down. And as you're reaching over most of the cribs these days, you can elevate the mattress. It can either be low or it can be high. So because the baby is pretty small and you're a new mommy, what I want you to do is bring that crib mattress all the way up so that when you do lift the baby, you don't have to bend over so far. Okay?
That's a good idea. Mine's very low right now.
It's very low? Okay, so jack that up a bit and that's going to help you with your back. And another thing I wanted to discuss is once you've lifted that baby up, when you're lifting it out of the crib, instead of reaching over like this, maybe you could try to just bend your knees a little bit and kind of scoop underneath to pick up. All right? Give that a shot too. And what we want to do is kind of adhere to the basic principles of proper lifting, which is going to be using your large muscle groups, keeping your back straight, bending your knees, establishing a wide base of support, and keeping whatever it is that you're lifting close to your body. That way you maintain a center of gravity that's close to your body. Do you have any questions so far? Okay. Another thing that I was thinking that might help you out a little bit is transporting the baby. So, well, actually, let me back up a little bit. Feeding the baby, seeing that we're still in the house, you've picked the baby up out of the crib, and now you're going to feed the baby. So what I would like you to do, whenever you're feeding the baby, are you breastfeeding or are you bottle feeding?
Bottle feeding.
Bottle feeding, okay. So whenever you're feeding your baby, you're going to sit somewhere comfortable, and I would like you to prop the arm up that you're holding the baby with. Are you right hand dominant or left hand dominant?
Right hand.
Right hand? Okay, so you probably hold the bottle with your right hand, I imagine. But you can switch it up too, and I advise you to do that. So keep good posture. Elevate your arm with a pillow, and that way you're supporting your shoulder, and that way you're not hiking it. All right? And make sure that your back is straight as well. And that'll help you while you're feeding the baby. You can switch off so that if one arm gets tired, you're not just going to use one side all the time.
Makes sense.
All right? And now if we have to take the baby out somewhere, do you have, what kind of car do you have?
I have a Toyota Tacoma.
So you have a truck, it's a little high. All right, is it 4-door?
Yes.
It is too, because you don't want to put the baby in the front seat anyway, but I'm sure you already know that. So, is the car seat rear facing or front facing?
It is rear facing.
Okay, so because the car seat is rear facing, you probably have it on one side or the other? Okay. Do you keep the car seat in the truck or do you take it out?
It's one of the ones I can go in and you can put it in and lock it in place. You can take it in and out.
Oh, okay, so you do pick it all the way up. All right, because you have an SUV, you really don't have to bend over, but when you do unlock it, and you crank that handle up, what you're going to do is just turn it around, and then bring it close to your body before you step away from the vehicle, all right? And the same thing when you're lifting, you're probably carrying it something like this. You want to keep it close when you're carrying it, that way you can have a good center of gravity. And as you keep it close and you bring it in, you can probably set it on, instead of trying to reach around and click it in all in one motion. We'll try it with a couple of different motions, or well, step by step is what I mean. So you'll put it in, turn it, lock it in, buckle it in if you have to.
I've noticed that sometimes when I lift it up and I just spin and put it in, it really hurts my back.
Yeah, we don't want to spin. You want to step,
Can you
not
step?
twist.
Can you demonstrate that for me?
Yeah. So if I had something that I was going to pick up, then what I would do is I wouldn't pick it up like this and twist to do it. What I would do is if I was going to pick it up, I'd bend my knees, keeping my back straight, pick it up, and then step, and then put it into the vehicle. Does that make sense? see you do that. Okay, that was a twist, so what you're going to do is just bring that right foot forward next time.
Okay.
Okay, that was a little bit better. I think we should work on that a little more. But not at this time.
Okay.
All right. If you have any questions, I'd be happy to answer them for you. No?
Enough of this work, mumbo jumbo. I'm gonna relax a little bit. We're gonna do a massage. You wanna put your, I know you just had a baby 2 weeks ago, but are you okay to be on your stomach? I can do it on the side or on your stomach.
Someone's fine.
Okay. Let me get some more pillows.
Take
I'm
my
gonna-
sweatshirt off.
No, I can just lift it. Something here for you. And then your ankles. Do you have any history of cancer?
No.
Great. And can you point to the area that's really bothering you?
Right here.
Okay. And I just washed my hands, just so you know. And your pain scale, what is it after all those exercises and everything?
Drop to about a 4.
Okay, well this is gonna make it feel really nice. Okay, I'm just gonna do some stroking to introduce my hands to you.
Hello, hands.
And maybe some effleurage. Are you okay?
Mm-hmm.
Does that burn at all? Okay. I think I'm gonna go into some petrissage now. Just let me know if you feel any pain. You shouldn't feel any discomfort. Some kneading. You okay?
Mm-hmm.
Is that pressure okay, or do you want more or less?
A little less.
Okay. Is that okay? I'm picking up now.
Mm-hmm.
So we're gonna go through all of them, or just... Okay, I'm gonna finish off again with some effleurage. And stroking. And that concludes the treatment. What's your pain now?
That feels a lot better. It's like a 1.
Oh, good. Okay, you might notice a